Few things in life are more satisfying than shopping around and getting a great deal. We compare prices for cars and clothes and just about everything. So why not for healthcare services? That's what Patty Everett asked herself after her husband suffered a catastrophic injury while they were between healthcare plans. And the result of that life-changing experience is a brand new way to do healthcare. Patty Everett, CEO of Healthpons, I just want to thank you for joining us today. I'm so glad you're here to share your story.
Thank you so much for having me here. I really appreciate it.
You know, and we have so much to get to, but really I have to start with what happened to your husband.
Well, he fell 2 stories and he broke his neck. And when I took him to the hospital, because we didn't have an insurance policy in force, they told me I needed to take him home because it wasn't life-threatening, he could breathe. However, if one of the children jumped up and hugged him, he could be a quadriplegic. So I had to go to the bank and drain $50,000 out to get him in the hospital and get the surgery done. So we exhausted all of our savings and my inheritance and all the money he had from his business to get him taken care of.
Wow, and how much in total did you spend on?
We spent a little over $500,000 in the first 6 months.
That is just devastating.
It is devastating.
And you came to some important realizations then about the healthcare system and the way it's working. Tell me about that.
I did. I learned that there was nowhere to get a cash price. If you're paying cash, why can't you have the same price as an insurance company? There was no option to compare prices between different surgeons or hospitals, and so we were stuck. And that got me to thinking, why can't we get a discount? Why can't we shop if we're paying cash? Why shouldn't we have the best price?
So am I right in assuming that our healthcare providers aren't mandated to post the price of their services?
Well, that's absolutely correct, Julie, until the Affordable Care Act changed that. Now they are required to post the prices in somewhere reasonably for people to be able to see them. But there's no format for it. There's no instructions. There were no guidelines given with that. So what we did is we looked at the Affordable Care Act and said, how can we bring pricing transparency to the market, and how can we get doctors to help us get a price that's lower?
So that's where Healthpons comes in. Tell us exactly what Healthpons is.
Healthpons is the very first portal for healthcare shopping. You get to choose by city, state, zip, by doctor, by specialty, or symptom if you don't know where to go. You can go on and be a consumer of healthcare, get real-time pricing. You see the prices that are available today. So if you need something done, you need an MRI, you need to see a primary care doctor, an orthopedic, a neurosurgeon, you can see the prices for their services.
It sounds like a true breakthrough for consumers. So if you want to start saving on your healthcare, stick with us because Patty's going to tell us exactly how Healthpons works right after the break. Welcome back to The Balancing Act. Before the break, my guest Patty Everett was sharing her personal story about the staggering cost of healthcare and about a possible solution called Healthpons. All right, Patty, what exactly is Healthpons? You told us, but how does it work? That's what I want to know.
Healthpons works by going to our website and finding the right doctor and the right price. You simply input whatever you need to know, whether it's by symptom, specialty, city, state, or zip. Now, some people think it's only for people without insurance, but it's not so. It's for people with insurance as well. You know, deductibles are getting higher now. And we know that statistically, $2,500 deductible, only 11% of the people with that will ever reach it. And then if it gets higher, like the new plans, $5,000 deductibles, only 4%. So that means 96% of those people are self-insured. So if you had a choice and you could pay $1,200 or $600 for a service, which would you choose?
I'm going with 6.
Okay, well then you come to Healthpons.
Perfect. I honestly think a lot of people are still confused about terms like co-payment, co-insurance. Could you refresh people's memories about what those terms really mean?
The most important thing to remember is your co-payment is that amount of money that you give the doctor when you check in. Sometimes they ask you for the $25, $35, $55 co-payment. The deductible is the amount that you have to pay before your insurance company starts paying. This is where everyone gets confused. Co-insurance. It is different than co-deductible. Your co-insurance is that amount that you pay after the bill has been submitted and they determine how much is owed. Your policy will dictate how much you pay of that bill, 20%, 30%, 40%, and you pay that after you've paid all of your deductible.
So I find it really interesting that there are millions of insured people who are still basically paying for everything out of pocket. I want you to give us an example of how Healthpons prices can help those people and others.
Well, for example, if you need an MRI, very often you will get a bill for around $7,000. I had one in January and it was $7,226. Then I got a bill, my co-insurance, for $1,200. Now, if I had gone to Healthpons, I would have paid $695.
What other options can consumers choose on Healthpons besides price?
They can choose to find a doctor by his specialty. They can look at his education, and most important, the quality of his care. So we evaluate a doctor's based on what his patients say, not some random opinion on the internet, but what his patients say about him. We look at his education. Does he have a medical degree from Harvard, or is it from a foreign country? What hospitals are they associated with? So you can learn much about your doctor before you go see him.
And what about emergency care?
Emergency care is not included in Healthpons, but we do have urgent care facilities. So they can find those for the things that are non-life-threatening. Now, what we do have are hospitals that are starting to get on board with us and post their pricing. And because of that, we decided to bring something to the consumers that we know they need. Those high deductibles, even if you do get a good price, sometimes you can't afford it. So we have a patient financing program available to all our hospitals in our network and all the providers associated with them. And it's 0% financing, no interest, up to 72 months.
That can help a lot of people, really. And there's another convenient feature on Healthpons that will make a patient's digital medical records available. Tell us about that.
Absolutely. You can go to Healthpons and you can store your medical records there and your medical history. And when you're traveling, if you're skiing in Colorado, rock climbing in Arizona, or jet skiing around the world, you can go online and see all of your medical information and share it with any provider you choose.
Where can people find out more about Healthpons?
Come to our website,
Great.
healthpons.net.
So it's one-stop healthcare. Sounds like an idea whose time has come. Patty, such great information. I want to really thank you for being in the studio with us.
Thank you so much for
having
me.
And thanks for sharing your story and your husband's story.
I appreciate it. Thank you.
All right, I'm sure you can't wait to start saving on your healthcare, so head over to thebalancingact.com to get started, and don't forget to follow us on Facebook and Twitter as well.